Arenas. I'm with Telesur. I just wanted to know, there are 72 hours, critical hours for rescue. What comes after that, since those 72 hours are already done? What comes now? What are the measures?
I would say that what you referred to, the likelihood of saving survivors, certainly is increased within the first 72 hours, but still remains even to this day meeting here. So the search and rescue teams working around the clock 6 days after the event, they will still be able to find additional survivors. But that number, as we speak, the probability of locating these survivors from now until tomorrow until the next day greatly diminishes. So as we get through this initial period where the major focus is on search and rescue, we will continue to focus on the treatment of those that have been identified, that have been rescued, as well as all the other injured that are in country. And most of that treatment focuses on the care of trauma, the fractures that have resulted, the crushed injuries, the critical areas of need, particularly on the trauma. In my presentation, I wanted to also keep us alert and attentive to the fact that even without this disaster, there are existing health needs that we must continue to maintain and put focus on, such as the pregnant women that need obstetrical services, as I mentioned. Ma'am?
Sorry, Hi. Sorry about that, CNN. I'm wondering if you can go into a little more detail about what your staffers are seeing on the ground. How chaotic is it? How easy is it for people in need of medical services to reach you? How aware are Haitian citizens of your services, where they can find them? Just more detail if you could. Thanks.
Okay. Well, at the beginning, there's essentially no communication. And I'll cite an example, a personal example of our own organization. I'm sure every organization, every agency, any group that's working on the ground has similar examples. But we have one colleague working on our staff here in Washington whose husband worked for a non-governmental organization and was in Haiti when the earthquake struck. She did not hear from her husband for 2 days. At that time, all agencies were told not to move. There was no communication. The roads were essentially all blocked. But progress has been made. Her husband was found, and we are, as of 2 to 3 days ago, convening this daily meeting of all agencies and interested parties working in the health cluster. That's our focus. So that's the fact that people can come to that meeting, share their information, particularly the work that they've been doing with needs assessment. What are the problems? How can we manage existing resources? I think that's an important achievement and component. So at one point during this, it became clear to us that we actually could communicate from here to individuals working on the ground better than they could amongst themselves. And in fact, that continues to be a problem, but I am encouraged to hear that this meeting is going forth and that there are ways to more effectively share information. We must recognize that the city was essentially destroyed. So during that initial period, communication was non-existent. Yes?
And just following up on that, just a couple more specifics about, again, like people who might be on the streets and maybe are having these communication difficulties. What efforts are you making to communicate to them? This is where our services are, you can reach us here, et cetera, and just a little more about what people are hearing on the ground as of today and maybe going forward.
I'm going to have more information later today when we have a series of conference calls And this happens on a daily basis. So we will have a country conference call, followed by a global conference call, followed by conference calls directed to some of the key major partners such as the U.S. government. As we collect more information, we'll be able to share that. Specifically, today we have better clarity on the distribution of hospitals and health centers, but still far from perfect. We're still seeing as I mentioned, the challenge of the management of dead bodies, and we're trying to put efforts into better handling that. But in terms of health services, some of the bottlenecks that have prevented incoming medical team supplies and field hospitals, I think we're also seeing that progressing. So that's what I can share at the moment.
Do you guys feel like you're pretty effectively reaching people that might have communication difficulties? Do you feel like you're pretty efficiently reaching a larger part of the community, maybe with the last couple days? Or
If we were to be self-reflective, I think that we're not satisfied at all. We're not satisfied. Conditions are incredibly challenging, but I can tell you that we're doing our very, very best despite these difficult conditions, and we continue to try to monitor and evaluate not only the situation but our own performance. Are we delivering with what we have? And so those kinds of hour-to-hour needs assessments are very important. The director of our emergency operations unit, Dr. Jean-Luc Poncelet, came up to me just a few minutes ago and requested more staff for his unit. So in order to make those requests and follow up on the actions required, you need to be questioning, as you have mentioned.
Are there any other questions from in the room? If not, we have one that came in electronically, John, from Jacques Girard in Chile, who is asking, how is the PAHO response team in the field conformed at the moment, and what kind of agenda do we have to continue with the health systems and services colleagues in the future, so as not to face improvisation in organizing health services? Is that in the works?
Okay, there were two components to that question. The first, I believe, has to do with how our team members are selected. There are a number of requirements. I think working in Haiti, being the poorest country in our hemisphere, with certainly overwhelming challenges, experience is very, very important. No matter how smart you are, no matter what technical skills you may bring, you may not be able to operate in those conditions, may not be able to function effectively. So that's an important element to consider. The local language, if you don't speak French or Creole, that could be a barrier to how effective you are. The skill set that a particular consultant or staff member has must be in alignment with the identified priorities. I think those are a few of the guiding principles we look for when mobilizing human resources. I've always felt that one of my longstanding colleagues from years ago from PAHO, Dr. Cyril de Quadros, always mentioned the key characteristic that he looked for in staff was flexibility. And certainly this situation challenges anybody's flexibility, resilience to respond. The other part of the question had to do with the agenda going forward, and I think I attempted to outline the importance of addressing those infrastructure systems related needs, including the reconstruction of safe hospitals. This has certainly been a tragedy. But in the response, we must take care and take advantage of opportunities to reverse perhaps some of the interventions that have been conducted in the past, not focusing enough on health infrastructure. And so that I think that's an important, indeed important component. Dr. Galbao, who works in our organization, is a key expert on health systems, and his team certainly are already engaged. They're attending these hourly meetings, they're providing their inputs and following up on recommendations.
Okay, thanks, Dr. Anderson. We have one more question that came in about U.S. cooperation, or two more questions, sorry. U.S. cooperation with PAHO. Have we been, has HHS and other U.S. agencies been in contact with us, and are they collaborating with PAHO in this response?
The answer is overwhelming yes. I've already had, I think, 3 phone calls with the interim director of the Office of Global Health under the Secretary Sebelius's Health and Human Service administration just this morning. We'll have other calls with all those involved, including the State Department, USAID. Yesterday I was on the phone with the director of CDC, Dr. Tom Frieden. We are coordinating this channel of communication with daily teleconferences. Today we have one at 5 o'clock. So there's a great effort to to effectively collaborate and share information.
And then the other question that came in is with respect to mental health. Do we foresee major mental health and psychosocial support needs in Haiti as a result of this disaster?
Most definitely, and that covers the the anguish related with loss of life, loss of loved ones, the shock and trauma from every imaginable angle, I believe, and so we will need to support and provide those kinds of services. There's no question.
Okay, and then Maggie Fox from Reuters, who was watching your live stream briefing, says you mentioned in your briefing that there had been some interventions in the past that were not effective. Could you give us some examples, please?
Well, the Safe Hospitals is a very specific example where when funds are provided to build the health system, that assurances are in place as well that what is constructed or how the funds are used to ensure a safe building that can withstand the shock. But beyond that, imagine yourself Minister of Health Haiti and having a number of external partners, all champions of their health area that they're promoting, and somehow streamlining that process will be important. But that the emphasis on primary care in the future that's integrated, comprehensive, with all elements of the infrastructure being addressed, I think will be important.
We have a question from El Nacional of Venezuela. And it's with respect to vaccines. Will we continue basically our vaccination programs in Haiti, or when do we foresee continuation of the vaccination programs?
That will be also an essential element to the response, particularly in the long run. I cited data to show you that before the disaster, there were already difficulties in ensuring that every child is vaccinated. So beyond this immediate response period, in the long run, in the months to come, those basic services that would include primary health care, and immunization is an important component to primary health care, obstetrical services, and so on, will be important to address, recognizing the challenges that have existed in the past and how to assure ourselves that every child is reached with the necessary immunizations, because they are one of the most cost-effective interventions we have.
Okay, we have another question. Go ahead.
Okay, it's a follow-up from Maggie. Sorry, sir, Meg Page. Can you comment further on reportable disease? Any signs of typhoid and other related illnesses?
As I mentioned, we have not heard of any reports of major outbreaks, and typhoid is one bacterial disease that presents itself often in outbreak form, but yet to date we have not received those reports. We are alerting our staff to be on the lookout. They have tools that they are using to collect information and report any sporadic case of most any infectious disease that could pose a problem by becoming transmission in an outbreak situation. So we want to prevent that. To date, I haven't heard that. Also along the border, there's been a mass movement of people going to Dominican Republic for treatment, for services there, and we haven't heard any increased reports, and we will keep you posted when we learn anything new.
Another one from live stream is Marsha Lin. Are there any emergency measures being put in place to establish a telemedicine network? Who may develop in telemed networks contact to collaborate with organizations in Haiti? I am in Florida and there is a huge effort for telemedicine.
That's a great question, and I think that's an area of consideration worth following up on, because the provision of expertise using IT technology can be very effective when done well. So that the local infrastructure is so depleted that you do need some basic infrastructure in order to carry out those kinds of interventions. But I think it's worth putting on our list to follow up.
Okay, any other questions from people in the room?
Thanks again.
Go ahead.
If you could just go into a little more detail about the number of people being evacuated for medical services elsewhere, you said to Jamaica, Dominican Republic. Do you have a sense of how many people, and if you're evacuating the people with the most severe issues, how that process has been, efficiencies and inefficiencies?
There is an effort to triage patients, not only within the city. I mentioned the effort of the Israeli hospital with limited bed capacity to serve for the seriously injured patients that would need specialized care. I don't have figures, I don't have numbers at the moment how many are being evacuated outside the country. The two countries that are helping in this area most are the Dominican Republic and Jamaica. I think with the arrival of the hospital ship Comfort, that would help with that particular issue.
We have one more there.
One more from live stream, Meg Page. Can you please comment on security for medical staff in country?
It's a challenge. It remains a challenge. Beyond that, there are various clusters, the health cluster in the United Nations system, that address aspects of the response. I mentioned that WHO PAHO is in charge of the health cluster. There's also a cluster on logistics, which covers security. the United Nations building and offices that manage security were essentially destroyed. So we're building, that cluster is building itself back up. Partners such as the U.S. government with its military humanitarian response is trying to assist that cluster, and the Haitian government efforts to ensure security. It still remains very, very challenging.
There's another question, live stream from Marsha Lynn. She's asking, who may I contact? I'm in Telemed in Florida and need a contact at PAHO. We're ready to help with telemedicine. We need to cut through the bureaucracy to leapfrog this technology now.
I would suggest that she contact our EOC.
At
E-
PAHO.org.
Yes, and they will take her suggestion, and our unit that manages health technology and information will be able to respond back to her.
EOC at PAHO.org. There's a follow-up question from MedPage. But is there danger for medical staff?
Yes, and I could speak from personal experience in a former life, having been a district medical officer in Malawi, Africa, where you're operating under conditions without a blood bank, where sometimes surgical supplies are limited and you expose yourself to risks with needle punctures when you don't have suction to manage surgery or an emergency. So yes, the health provider on the line is at risk. We know tuberculosis has the highest incidence is in Haiti. There's a risk of continued spread if medications are not provided. That being a part of the primary care response and requirements that I mentioned that included immunization, obstetrical care, the provision of medications to patients that are diabetic and have infectious diseases like tuberculosis. But that medical professional at the point of service on the front line is indeed at risk. And I think we have to step back and reflect on how important they are and support them for the sacrifices that they're making.
The questioner clarifies that the danger they wanted to know about was from violence and unrest.
That's another concern, security. You know, in the response to a disaster such as this, there are certain guiding principles. One is coordination. We've talked a lot about that, the role of communication, the provision of health services, and another one is just maintenance of security. That is still a challenge. So working with the logistics cluster, supporting the efforts of that cluster will be important.
We have a question from the Wall Street Journal, Betsy McCain, who is also listening in electronically, and she's asking about the health cluster and the health cluster meetings that PAHO has been involved in with the organizations on the ground. Can we talk a little bit about what kinds of issues are being discussed in those health cluster meetings?
I can share what immediately comes to mind. The needs assessment is so important to respond effectively. The influx of medical supplies, resources, medical teams, and so on, the big challenge is directing those resources to where they are needed most. And to do that, you need data. You need data to be able to target where these resources need to go. And I think that's a major, major topic that they're discussing and trying to share information, each trying to improve the coordination and the work that they are individually doing as agencies or organizations that become more collective work rather than fragmented work. So that's a big challenge. I'll stop there.
Okay, and then I think we have one last question from Manuel Loaiza, which you mentioned in passing in your briefing, but he asks, can you talk about what diseases are epidemic potential risk in Haiti, and what are the epidemiological actions we can take to combat those diseases?
The waterborne diseases are certainly a risk when you have a disruption, a major disruption in the water supply. If it becomes contaminated and people continue to use sources of water from the infrastructure, that's certainly a huge area. Measles, I mentioned, is particularly a concern when you have displaced populations, and we're seeing people on the move, leaving Port-au-Prince, locating in other areas, or even within the city of Haiti where there are clearings, congregating and having a more densely populated area. And it's in these conditions that measles has been known to cause outbreaks, and so we have to pay particular attention to that. Respiratory illness is always a problem. We just come off the heels of the second wave of the H1N1 pandemic. We hope that doesn't raise its ugly head, or other respiratory illnesses. So it really emphasizes the need to immediately implement the good public health practice. Collect the data, monitor it, and then respond as effectively as you can under enormous challenges there.